Here is the literal English translation of the provided text, the continuation, rendered sat nia, closely faithful to the original meaning, with no changes whatsoever to the content, structure, wording intent, paragraphs, tone, or any details. Today I want to talk to you about something that very many older people are experiencing without even knowing it. That is kidney failure. Not because they are careless, not because they neglect their health, but simply because kidney failure is one of the most silent diseases I have ever known in many years of practicing my profession. It does not knock loudly. It does not cause intense pain right from the beginning. It comes gently, quietly, and usually by the time you discover it, the kidneys have already lost most of their function. What worries me the most, and is also the reason I want to talk straight with you today, is that in older people, the signs of kidney failure look very much like the things we often call normal things of old age. Tired? Well, when you're old, you're just tired. Legs a bit swollen, stood too much, wake up at night to urinate. At this age, who doesn't? That very normal mindset has caused so many people to miss the golden opportunity to intervene early. Therefore, today's talk from me is not intended to make you worried. On the contrary, I want to give you something more precious. That is understanding. Because when you know what your body is saying, you can act before everything becomes serious. And the wonderful thing is, the self-checking methods I am about to share, you can completely do right at home without needing any complicated equipment. Let me start by briefly explaining what the kidneys do in your body, because understanding this will help you understand why the signs appear like that. Your kidneys, two small, fist-sized organs located on both sides of the lower back, are a non-stop blood filtering machine. Every day they filter about 200 liters of blood, separate toxins out through urine, regulate the amount of water in the body, control blood pressure, maintain mineral balance, and even stimulate the production of red blood cells. Such a small organ carrying so many tasks. When the kidneys begin to weaken, all those tasks are affected. And that is precisely why symptoms appear everywhere in the body, not just in the lower back area or the urinary tract. The first sign I want to tell you about is prolonged fatigue and lack of energy. I know what you are thinking. Who isn't tired when old? But this is the important thing I want you to understand. There are two very different types of fatigue. The fatigue of old age usually comes after you have done a lot of activity, and when you rest enough sleep, you feel better. But fatigue due to kidney failure is completely different. It persists. Without clear cause, you sleep all night and still wake up feeling like you haven't slept. You lie down and rest for half a day and still don't feel your strength return. The mechanism of this is quite interesting to understand. When the kidneys work poorly, they reduce the production of a substance called erythropoietin. It sounds difficult, but simply this is the substance that stimulates the body to produce red blood cells. Fewer red blood cells means less oxygen is transported to the muscles and cells. Just imagine like a motorcycle lacking gasoline. It can still run, but it runs slow, laboriously, and is always on the verge of stalling. That is why you feel exhausted even though you don't do much. The way to self-check at home is very simple. Take a small notebook and record your energy level every day for a week. You can score from 1 to 10. If the scores are consistently low, even though you sleep enough, eat and drink normally, nothing special happens. That is a notable signal. Especially if you find that walking a short, light distance also makes you short of breath. Climbing a few stairs also requires rest. This is no longer normal old age. This is a sign that needs to be checked. The second sign is edema, or simply swelling. Weak kidneys cannot excrete water effectively as before, so water begins to accumulate in the body's tissues. The place most often affected is the legs, especially the ankles and feet, then the face, or especially the eyelids in the morning, and sometimes the hands too. The home test that I often guide is very easy to do. You use your thumb to press lightly on the ankle, hold for about 5 seconds, then release. If the place you pressed leaves a dent and takes quite a long time to fill back up, that is called pitting edema. And this is a worrying sign. A person without edema will have the skin return to normal almost immediately when the hand is released. There is one thing, I want you to pay extra attention to. Edema due to kidneys usually occurs symmetrically on both sides. Both legs, both ankles, both eyelids. If you only swell on one side, for example, only the left leg, then it may be another cause such as blocked vessels or vein inflammation. It is best to check the legs in the evening because water will accumulate more after a day of standing and walking, and check the face in the morning right after waking up. Now I want to talk about a sign that very many people have but do not notice. That is changes in urine. I know not everyone is used to observing this, but urine is actually one of the most accurate reports that the kidneys send out. When the kidneys function normally, your urine is light yellow and clear, without much foam. When the kidneys begin to have problems, there are 3 changes you need to pay attention to. The first is foam. Normally, urine can also have a little foam when the flow is strong, but that foam will dissipate quickly. If you see thick, white foam that takes a long time to dissolve, still there, after you have washed your hands, changed clothes, that is a sign that the kidneys are letting protein escape through urine, something that healthy kidneys never allow to happen. Protein is precious. The kidneys must keep it in the blood, not let it be lost. When the kidneys are damaged, they can no longer do that. The second is frequent nighttime urination. Very many older people are used to having to get up once at night. That is quite normal. But if you have to get up 2 times or more every night regularly for a long time, that is a signal that the kidneys are not working on the right schedule. During the day, healthy kidneys filter a lot. At night, they filter less so the body can rest. When the kidneys weaken, this cycle is reversed. The third is the color and amount of urine. Abnormally little urine, dark color like strong tea, or sometimes light pink color, all are signals that need attention. The simplest way to check is to count the number of times you urinate in a day and observe the color for a few consecutive days. If you see abnormalities lasting more than a week, please let the doctor know. The fourth sign that I want to share is unusual itchy skin and dry skin. This is a symptom that most people never associate with the kidneys, and that is precisely why it is often overlooked or treated incorrectly. When the kidneys weaken, toxins accumulate in the blood, especially urea, a byproduct from the protein metabolism process. High urea in the blood will irritate the skin from the inside, creating a persistent, itchy feeling without any lesions on the skin, no rash, no clear allergy. The characteristic of itching due to kidneys is itching all over the body, not localized in one place, and often worse at night. This causes the patient to lose sleep, scratch a lot, and the skin gradually becomes dry and thickened. If you are itching and have used moisturizing cream, taken regular allergy medicine but do not see improvement after 2 weeks, this is the time you need to think about the kidneys, not just think about the skin. The way to distinguish is quite clear. Itching due to dry weather, food allergy, or chemicals usually has a clear cause, will improve when avoiding contact with that agent. But itching due to kidneys has no clear reason and does not improve even though you have done all the usual skincare methods. Next, I want to talk about a group of symptoms that many people often mistake for stomach disease. That is, loss of appetite, nausea, and strange breath odor. When the kidneys cannot filter toxins out, these substances accumulate in the blood and affect the entire digestive system. Your stomach begins to feel uncomfortable even though you didn't eat anything heavy. You look at a bowl of rice but don't find it appetizing even though you used to really like it. Waking up in the morning often has a slight feeling of nausea, even though the stomach is empty. The most characteristic sign of this group is a metallic taste in the mouth, as if you are holding a coin, and breath with an ammonia smell. That is, a smell like urine. It sounds unpleasant, but this is a very important sign. High urea in the blood will be partially metabolized in the mouth and digestive tract, creating that characteristic smell. If you are eating less than 50% of normal, continuously for a few weeks, accompanied by nausea and a strange taste in the mouth, don't just think about the stomach. Please consider the whole picture. If accompanied by fatigue and swelling, then the possibility related to the kidneys is very high and needs to be checked early. The sixth sign is lower back pain in the kidney area. I need to clearly distinguish this from ordinary lower back pain due to spinal degeneration, because these are two things that are very easy to confuse. The kidneys are located in the back, right below the last ribs, on both sides of the spine. When the kidneys are inflamed, have stones, or begin to fail, this area can have dull pain. The way to self-check at home: you use your fist to gently tap on both sides of the back, right below the last ribs. If you feel deep pain inside when tapping, even lightly, that is a notable sign. Kidney pain is usually deep. Dull does not change much when you change posture. Meanwhile, spinal pain or back muscle pain is usually more obvious when you bend, twist, or stand up and sit down. If the pain in the lower back lasts more than a week, without clear reason not related to movement, I advise you to go for a checkup. And the last sign in the 7 signs today, this is also the sign most often overlooked, is high blood pressure that is difficult to control and frequent cramps. The kidneys play a very important role in regulating blood pressure because they control the amount of salt and water in the body. When the kidneys weaken, they retain too much salt and water, causing blood pressure to rise. The dangerous thing is that many older people are taking blood pressure medication regularly, but blood pressure still does not go down. And they think it is because the medication dose is not enough, while in reality, it is because the kidneys have a problem. If you are measuring blood pressure at home, something very recommended, and see that blood pressure is still high, even though you have taken the medication on time and at the correct dose, please tell the doctor about the possibility related to the kidneys. Do not increase the medication dose on your own. About cramps, the kidneys regulate the amount of potassium, calcium, and magnesium in the blood. When the kidneys weaken, this balance is disrupted, leading to cramps, especially in the calves at night. If you have cramps more than 2 times a week without clear cause, not due to much exercise or lack of water, this is a signal worth asking the doctor about. Now, after I have shared all 7 signs, I want to say one very important thing. You do not need to have all 7 signs to be worried. In fact, early-stage kidney failure often only manifests through 1 or 2 small symptoms. The thing I want to emphasize is, if you find that you have 2 to 3 signs at the same time, especially the combination of fatigue and swelling, or frequent nighttime urination accompanied by difficult-to-control blood pressure, or persistent itching accompanied by loss of appetite, then this is the time you need to see a doctor for blood and urine tests. Those 2 simple tests can reveal a lot about the health of your kidneys. A common feature that I want you to remember about kidney failure is, it never manifests clearly in one place. Not like appendicitis, intense pain, and a specific location. Kidney failure spreads throughout the body: fatigue, skin, digestion, blood pressure, body limbs, sleep. That is why it is very easy to be mistaken, to be explained by other reasons. And this is the key point. The elderly body does not always react strongly like young people. Young people with kidney failure may have severe pain. Older people sometimes only feel vague discomfort. And that very vagueness is the most dangerous. What I want to say to you, as a health companion, is to become the main observer of your own body. Not to worry, not to panic, but to recognize when the body needs help. Every day, spend a few minutes observing. Today, how is my energy? Is there anything abnormal in the urine? Are the legs swollen? Is the sleep good? That is not being overly cautious. That is loving yourself. And please remember that detecting kidney failure in the early stage can completely slow down or even prevent the disease from progressing more severely. Kidneys that are partially damaged can still be protected, can still function well for many years if cared for properly. Controlling blood pressure, eating less salt, drinking enough water, avoiding painkillers on your own, and going for regular checkups. I want to conclude with a sentence that I always say to the people I consult: the body always has signals. The problem is whether you recognize them or not. Your kidneys are not completely silent. They are talking to you in their own way. And now you already know that language. Please listen to it. Please cherish it. And do not hesitate to share with the doctor when you see something is not right. Your health deserves attention, not when it is too late, but right from today.